This month's topic is vegan health, and our esteemed guest speakers, we have Deepak Kotecha and Smita Kotecha. I call them the vegan power couple since husband and wife team. Just a little bit about each individual. Deepak graduated with honors from the University of Houston downtown. He completed his optometric, I can't say that word right tonight, optometric training at the University of Houston College of Optometry in 1989. Rotating through Herman Eye Center and MD Anderson Hospital. He is in private practice in Houston. He also serves on the Board of Trustees of the Institute for Spirituality and Health at the Texas Medical Center in Houston. Deepak is also a black belt in Taekwondo. Very impressive. Smita graduated from the University of Houston College of Pharmacy in 1990 and is practicing pharmacist in Houston. She is also an advanced yoga teacher and implemented and oversees integrative yoga, patient care, and human biofield research at the Eyeglaciers of Houston. And Smita is a mother of 2 teenage boys and enjoys meditation, cycling, and swimming. And both are vegans. So let's give a warm welcome to both of our presenters tonight.
All right, so if I was to start by defining health, and I asked everybody for their opinion of what is health, we're probably going to get an average of an answer that says absence of illness. And we all are familiar with that answer, and we know it doesn't work. If I was to take the medical book with every test in it and throw it at everybody, I'm going to find something wrong with each and every one of us. It's just the nature of the beast. But beyond health, we have to start looking at total health. So let's look at this statement for a moment, and I want to thank my brother, Dr. Kotecha, for this slide. But you know, it's okay, it's normal to split open a chest and do bypass or heart surgery, right? But it's radical to go vegan, so we can prevent this in the first place. We need to challenge some paradigms, right? So as Osho says, question your answers. Let's look at some emerging paradigms. So here is a little article that DARPA put out that says viewing the body as a bag of chemicals and treating it with other chemicals is so 20th century. In the future, the treatment's going to focus on electrical impulses, light impulses, magnetic waves, and so forth. This is DARPA, okay? That's the Defense Department. Here's another article from Harvard that says that yoga and meditation can bring down healthcare costs by a little over 40%. So think about social and economic cost to the society, to the nation, right? Let's look at just one more. Here's a PubMed article that did a meta-analysis of studies and says yoga and meditation even helps type 2 diabetes, right? So, as optometrists, we are privileged. It's one of the places in the body where we can just dilate the eyes and look in, and we can see tissue in vivo without disturbing it. Okay, so this is what the back of a human eye will look like. That's the retina, the optic nerve, and the blood vessels. Here's a patient that has bleeding in the back of the eye. The left eye, which is to your right, has bleeding, and let's switch to a different view. And you can tell there's something going on there. There's hemorrhaging there. There's a little bit of light, so we can't really see that well, but there's some bleeding going on. This happens to be a patient that's hypertensive, but we'll also see this in diabetes and other diseases. I've seen it in patients that have anxiety. So bleeding in the back of the eye is a serious issue as well, right? Because patients go blind, and these become life-altering events. You okay? So here's another patient that has chronic corneal disease, where the cornea refuses to heal. Here, we intervened with stem cell and amniotic membrane therapy, and the cornea got better pretty quick. Simply correcting myopia or other refractive conditions with glasses may or may not be sufficient. So Smita and I approached this with different ideas as well. One of the things that we do is treat them with contact lenses that may slow down or reduce the progression of myopia if it's a young patient, but then we don't stop there. We use yoga and lifestyle intervention to actually help start making differences in the environment, which helps reduce the progression of myopia. By the way, we have seen changes in patients as late as 42, 43 years old. So we have been able to make real changes. Here's another patient. This is an interesting patient. This patient has cataracts, or had cataracts. The cataracts were not operable because the patient had other issues, other conditions. This patient also happened to be taking statin medications to lower her cholesterol. This patient had cancer at that stage, so we could not go in and do surgery. So we intervened with yoga, meditation, lifestyle changes, and a mostly vegan diet. And this picture on the right, on the left here, that's where the cataract is. And this is the same patient about a year later, and the cataract's gone. Okay? So we can think about yoga and meditation as a viable approach for patients, as part of the toolkit that we need to be able to offer patients.
So, in the middle of all this disease talk, let's not forget something. In the center of all this is a human being that has put so much trust in our professional expertise and deserves the best that we can offer. So how do I and Deepak, both of us, approach our patients? Let's take an example of a patient who had a retinal bleeding because of hypertension. What should we offer this patient? Naturally, we should provide a good medical treatment and stabilize the patient. So once patient's blood pressure is under control and now he's on a medication, should we stop there? Let's ask, should we stop there, or is there something else we can do for this patient? Should we sentence this patient to life with medication? And the answer is maybe, maybe not. Medication is necessary, but when we take medication, we should also remember this, that every ill doesn't have a pill, but every pill can have an ill. When you take medication, it comes with some side effects. It could be minor, there could be some major side effects, and they're known as adverse drug reaction. And as a pharmacist, I see this every day. We have opioid crisis in our country today. Pain medications are overly prescribed and used. Patient gets addicted to that. Antibiotic. Overuse of antibiotic has given birth to superbugs, where antibiotics no longer works. So with all this going on and with all this in mind, what can we do for our patient? Deepak and I look at it this way. For acute conditions, we must use what West has to offer, such as medication, well-trained surgeons, right here we have, and other doctors, best pharmaceuticals. They have their place. But for chronic condition or for prevention purpose, since we say prevention is better than cure, what else can we do? I think, in my opinion, we should offer yoga. That's the best thing that it has to offer. So diet and yoga can be really useful.
So let's talk about yoga. What is yoga? And Smita's going to illustrate this with a few more cases that follow. But yoga is a system. It's a science. It's a process. It is not something that we stop at with just superficial exercises or pauses. That's where we start. But doing those correctly and understanding how we breathe starts to affect us. So doing yoga and doing it properly, understanding what yoga is, starts to become important. The correct knowledge of what yoga does from start to finish puts you in a powerful position to help your patient overcome whatever illness that they have without the drug side effects necessarily, or without the adverse reactions. So when we start talking about yoga, the first thing we want to do is not plagiarize. Where does yoga come from? Where does this knowledge come from?
Yoga is a science that's at least 30,000 to 700,000 years old. In reality, it is even older than that. It originates in India, which is Bharat. Also, the teachers are rishis, munis, and yogis. The language they use is Sanskrit. And the core texts where you can find true knowledge and wisdom of yogas are listed right here. According to the science of yoga, we are made up of 5 gross elements with 3 qualities: When these three qualities are expressed, we get what we call is thoughts, emotions, and actions. Further, yoga science says that this human being or this person is made up of 5 layers. The outermost layer is, outermost layer is Annamaya Kosh, which is made up of food. Also, the third innermost layer is the Manomaya Kosh, which is our mind. So we are what we eat. So it affects our body as well as it affects our mind. So vegan diet is a great start where we can have a healthy body, less illnesses, and also our mind becomes focused and more useful and much calmer. I do want to point out the Pranamaya Kosh, where that's a life force. It does not only affect our physical body, but it also helps us with spiritual growth and mental stability. I will show you further in our presentation that how different breathing techniques can address that area. If we want to attain the total health, we must address all 5 areas, and that can be done with proper diet and meditation and then samadhi. Nadi system. This is a system that we have in our body where divine energy flows. Just like we have the digestive system through which food moves, and just like we have the nervous system through which impulses moves, we have a nadi system through which divine energy flows. Some of you must have seen this picture. This is the picture that we got from our human biofilm mapping, and these are called chakras. We have a nadi system through which divine energy flows, and these are the chakras through which it passes. Okay. To your left, the image that we obtained through our human biofilm mapping is before intervention of yoga or any breathing techniques, whereas to your right is after intervention with yoga and breathing techniques. This is another image that shows the patient was anxious and his anxiety level is quite high. And to your right, it tells us more about any other system in the body as to what's going on.
All right, here's another, let's jump back to science. So here's another patient. This is an interesting patient. This patient has a condition in the brain that is not operable. So Western science has nothing to offer her except higher and higher doses of medicine, which quit working. So she has a condition which is not operable and produces a tic in her. So then we jumped in with genetic and food sensitivity testing, and we found out, so she's allergic to almonds, wheat, and spinach, and this would cause inflammation in her body, cause the brain to change, and her tic would get worse. So after we did this, her tic got better. It did not resolve. It has not resolved.
Okay, so let's pause here for a moment and summarize. When we take medication, we may have benefit at the physical level, or if we have any procedure done, we will benefit at the body level, and we will achieve partial health, but it will also associated with some pain and suffering. If we want a total health, then we should engage body, mind, and spirit. And the way we can do that is with the proper diet. Vegan diet is a great start. And then through yoga and meditation. We have to engage all 3 together in order to achieve what we call is total health.
We ultimately are one, right? And when you do what is right, what needs to be done, whether it's an innocent animal or an innocent patient in front of you, when you do what is right, then ultimately we have spiritual evolution here, right? And once you start thinking about these kinds of questions, who am I, why am I, where am I from, life starts to unfold and the magic begins.
Thank you for your attention.